I'm Rohan Adarkar. I'm the founder and CEO of Heron Health. And yeah, I'll just give you a quick insight as to what Heron is. So I come from a family of doctors, and I'm the only technologist there, so I'm the outlier. And so I've grown up with my grandparents, my parents, running their medical practices and everything else, and having to do admin way into the night, so growing up, I'm 44 now, so I might date myself, and technology back then didn't exist um, to solve some of these problems. But now with the advent of AI and certain technologies, what we wanted to do with Heron is fashion a piece of technology that can kind of go and solve some of those non-clinical admin workflows that everyone has to deal with. And we designed a product ground up for to be secure and fit for purpose for clinics, for where anything from general practice right through to specialty medicine, dental practices, and even allied health. And we wanted it to be this one dashboard, one place where patients could interact, choosing an interface that was comfortable to them. So whether it's chat or whether it's an email or whether it's a phone call, and then be able to kind of take the load off your front desk team and have Heron come and step in there and help where possible. Yeah, Julia, let's go further. Without being able to do this myself, we have a great team behind Heron as well. So we've got Ben, who is our CRO, who might be on this call as well, and we've got a strong technical foundation of people who have been used to building very secure platforms from day one. So we've kind of designed this to be secure and very fit for purpose for the medical practice. Another key part of our technology stack is the ability to integrate, and that's what we're really excited about with the integration with the Alex API with Medtech. Is it really comes to life when it plugs into the heart and soul of your practice, the PMS. So that's what we'll talk through today, and we'll be able to demo that. So yeah, keep going forward, Julia. I'll explain to you a little bit about what Heron does, so you get a little bit of context there. So imagine your incoming inquiries coming in, and there can be calls that has had like an avalanche at 9 a.m. on Monday morning, and your front desk staff is overwhelmed, right? So you don't have the ability to deal with patients in the flesh as well as on the phone. You might be missing calls, and it's a very familiar thing to a lot of clinics. Also, the urgency of those calls, some could be deferred, some are very urgent, and there's no way of differentiating any of those. So what Heron does is step in there and can extend the capacity of that front desk to be able to instantly answer those calls, understand what those calls are about, and then work alongside your front office team, and also provide seamless human fallback. So if there's something that Heron cannot solve, you can actually loop it back into the human as well. And we've got kind of over the last few months deployed Heron without integrations into some practices across the APAC region. And now we're starting to really plug into the actual patient management systems as well. So without further ado, I think, seeing is so much more powerful. So let me take you through, and I'll share my screen here. And here we go. I think, Alex, you might have to, yep, here we go, share, and here we go, share. So you can see my screen now, and this is what Heron looks like. So in the back end, you might be familiar with the Kanban board sort of concept where things move from left to right based on cards, and you can take them and drag them across from left to right. So this is basically the workflow view. As you can tell, you've got identifying features here around the patient's name, the number they were calling from, the intent that they were calling from as well. and everything else. And you've got a bunch of features around views, so you can change the view, you can filter by channel where it came from, or even the intention that someone was trying to achieve when they called. So very cool things there. We have a dashboard which kind of gives you a breakdown as to your call volume, the engagement rates around how the calls ended. Another cool thing is what were patients calling about? So you can actually tell what patients were calling about. So you can see 68% are calling about appointment scheduling in our test environment, which is a great thing because that highlights the integration with the medtech. And then the outcomes and efficiencies as well. So how much time was saved, how many calls were completed successfully by Heron, and how many appointments and etc. were scheduled by Heron as well. And we do have contacts here, which we can sync with the PMS as well, which gives you the ability to quickly identify who's calling. At the moment, we use the name, the date of birth, and the phone number that someone was calling from to successfully identify someone. In addition, here you have the ability to set up access to the system and even add staff members, doctors and nurses and everything else that Heron can actually know who works at your practice without them necessarily having a login to Heron as well. Your clinic details gives you the ability to actually give us a little synopsis of the clinic, the type of clinic it is, and even sort of have your operating hours and everything else there too. And again, under Heron settings, you have the ability to give Heron's receptionist a name and configure the outgoing message and certain settings there. Include custom FAQs. So if there's anything peculiar about your clinic or you do things in a specific way, you want Heron to know about it. This is where you can kind of to tell it about those things. And under integrations is where you can see that it's actually plugged into Medtech at the moment. So it's connected there. And we do have notifications as well. So both in-app and email notifications, where if you toggle this on, you can get a daily digest, a weekly digest, or every inquiry that comes in emailed to you too. So that's a quick workflow overview of Heron. And now I'll just make a quick call. I'll be able to answer all your questions towards the end here, but here, let me make this call here. So you'll see my number come up under new inquiries.
Hi, this is Riverstone Medical Centre's virtual receptionist. Please note this call may be recorded to help us improve our service. How can I help?
Hi, I'd like to see a doctor, please.
Of course, I can help with that. Let's get started by confirming your details. I'll just need a few details to find your record. Can you tell me your date of birth, please?
Yeah, it's June 1st, 1981.
Thanks. Just to confirm, that's the 1st of June, 1981. Is that correct?
Yes, that's right.
Are you calling from the phone number we have on file for you? The
Yes.
number ending in 0658.
Yes.
Could you please tell me your full name?
It's Richard Green.
Richard, is this inquiry for you?
Yes, it is.
Do you have a preferred doctor for your appointment? We have Dr. Arjun Kapoor, Dr. Sarah McPherson, and Dr. Austin Chang available.
Dr. Chang would be great.
Perfect. Now, what day would you prefer for your appointment?
Friday would be great for me.
And what time of day would suit you best on Friday? Morning, afternoon, or a specific time?
How about 10 a.m.?
Let me check availability with Dr. Austin Chang for Friday at 10 a.m. It looks like Dr. Chang isn't available at 10 a.m. on Friday. We do have openings at 11 a.m. or 11:30 a.m. Would either of those times work for you?
Let's go with 11:30.
Booking your appointment with Dr. Austin Chang for Friday at 11:30 in the morning. One moment. Your appointment with Dr. Austin Chang is confirmed for Friday at 11:30 a.m. Is there anything else I can help you with today?
No, that's all. Thank you.
Thanks for calling Riverstone Medical Center. Have a great day. Goodbye.
Okay, so that was me finishing the call, and you can see here that Heron has received the call. It's clearly identified my number and my my contact in MedTech, which is Richard Green in the test environment. And once it kind of reads through it and creates a synopsis of it, it should move automatically, yeah, as it has then into scheduled. So you might have seen that jump here. It's unread. If we click on that, we can see what it's done. So it's actually scheduled it as here. There's no assigned priority, so you can manually give it a priority, whether it's urgent or not. You can tell the intention was about appointment scheduling, and here is all the details about the call. So you can tell Friday, 27th of February, the appointment was booked at 11:30 with Dr. Austin Chang, and it has been added to the MedTech schedule. Out here, you can actually play the whole call back. I'll save you that, but you can also see the entire transcript of the message of the conversation as well. So that gives you that ability. And here you can see in the TLDR, the caller's name, date of birth, and the patient can be different from the caller. So we've got that doubled up as well. And also the fact that the appointment was scheduled. Whoops, that's kind of creating thing. And Richard initially requested 10 a.m. but agreed to 11:30 due to availability. So that actually in real time checked the availability of Dr. Austin Chang in MedTech using the API and then made that booking. So I'll stop right there. That shows how the integration works. In addition to making appointments, you can also cancel appointments and reschedule appointments too. So yeah, the additional thing you can do. So one of the key things is how do you want Heron to plug in to your existing phone system? So there's three ways. One is if Heron acts as overflow. So say you have 2 or 3 receptionists, and if they're all busy at the moment, Heron can jump in and quickly answer the calls as overflow. Alternatively, you can do the reverse. So get every call answered by Heron and have the humans as overflow. Or you could give the option to the patient. So based on the urgency of the patient, they might press 1 in the phone system to transfer to Heron and answer, get calls answered by them, or by humans if they wanted to as well. So where we are, and go forward, Julia. And the other thing we have here, based on what you choose for your workflow, we've made it easy for you guys to work out based on your call volumes how that works. So it'll give you a quick breakdown of how you can work out what Heron would cost you. So we've got an ROI calculator tool that you can utilize as well. But yeah. We'll have that QR code link. You can use that now, or we'll have it at the end of the presentation as well. So you can use it as your own leisure, and no doubt you can reach out to me at any time, and I can send you a link to that.
So these questions have just come in throughout the webinar. So the first one is, could the AI check if the appointment is urgent?
Yeah, so I mean, thanks for that question. I think one of the things we've kind of tried to stay really true to is staying away from anything like medical triage. So we are not going to try and do anything like that. But if there are some nuances there around identifying certain words, or maybe there's certain other key things there that we could identify, we could work with you to get a workflow that works for your use case there. If it's really an emergency, like I'm having a heart attack or I'm having trouble breathing or chest pain, it's going to tell you this sounds like a medical emergency. Please ring 111. But for urgency things, we can work with you on exactly what your requirements are.
All right, next one. Can Heron alone manage a practice with 10 incoming phone lines? Great question.
Yeah, no, absolutely. And the answer there is a resounding yes. This is the beautiful thing about technology is that it can scale. And so it's not like having to lay out 10 chairs for people. You can have your three receptionists and Heron that infinitely scales based on your requirements. And yes, the beauty of APIs as well is that because it works in a secure way between Medtech and Heron, we can actually handle multiple interactions at the same time as well, and that can scale too. So the resounding answer is yes.
Next, how many templates can Heron deal with?
Okay, I see you've got a couple of questions there, so I'll try and answer both of those at the same time. So yeah, so as far as templates and stuff go, I believe so the way we've designed Heron is not to be like a little phone menu that you push one, you go down a little path. It's not hierarchical. It's basically an AI that you can have a very natural language conversation with. So it's not necessarily based on templates. It's based on it actually understanding the intention of what you're calling for, and then kind of working out the intention. So whether it's immunizations or travel vaccinations or appointment cancellations or whatever it is, and then kind of getting that intention and then putting it in a TLDR, like a little summary synopsis of the call, along with the recording of the call and the transcript of the call. So it's easy if the TLDR doesn't make sense to you, you can go back and review the actual call. You can look at the transcript and kind of work out what it is. So not necessarily template based, but kind of just a very natural language piece. And your second question, sorry, Alex, for jumping around, but
Go for it.
after ringing in and AI not working for me, can it shift the call to a human? And the answer there is yes as well. So you can at any time the caller, if the caller doesn't want to talk to Heron, can ask to be put to a receptionist. The way some practices have done it is put them back into a priority queue, so they're not going at the tail end of the queue again. So there's a way to do that. The other piece is if it's after hours, it'll know that your clinic is closed and be able to say, okay, actually, we'll get someone to give you a call back. Let me get your details.
All right, next one. Very good question. Can Heron manage multi-site practices?
Yes, no, absolutely. So one of the things in the actual dashboard is the ability to add more clinics as well. So you can add multiple locations and have Heron handle multi-site practices too.
Okay. How does it integrate with the phone line? And if our phones go down, does Heron receptionist still manage to pick up those calls?
Yeah, so with most phone systems, they are what run on a system that's called SIP, and in essence, we kind of just show up there as another extension. So Heron adds another extension on your phone line. Having said that, if it does go offline, Heron itself has a DDI. So if it's possible for people to ring that DDI, Heron will still operate. I'm not sure. This might be more of a question for your phone and your managed service provider to kind of answer. But yes, that the Heron to MedTech connection will stay open. Yeah, and it will work through that DDI.
And next, how can we identify how long the appointment can be, as a patient may actually need a longer time than the standard consult?
Great question there. So again, we don't want to bite off more than we can chew. So yes, at the moment we block out the 15-minute sort of appointment slots. but in the future, based on the appointment types and other requirements, like perhaps there's complexities there that are really specific. So you might need to see a nurse for a bit, and then you might need to see a doctor, or you might need to see a doctor for 30 minutes or 45 minutes. Those sorts of things we can build very easily, but we would work with you to be able to build that for your particular use case.
Fantastic, and very good question. Can Heron recognize who is a registered patient versus a casual patient?
Yes, so with the contacts area in Heron, we know we identify who the patient is, and then we can kind of work that out with MedTech as well. So we sync that data initially with MedTech, and then we can work out a cadence and how we kind of keep updating that as well.
Next one, is the pricing listed on your website based on calls per month? Or what happens if the call volume is higher?
Yeah, I think our calculator tool is the best thing to kind of use to kind of model your use case. And again, it's not necessarily about the total volume of calls unless you want Heron to answer all the calls. It's about the total volume of calls that Heron actually ends up answering. So that's what it's based on. And so you can tweak and play with that. And if you have any issues with that, feel free to email me or get in touch with any of our team, and we can help you through getting to the nuts and bolts of your pricing.
All right, and this is a very good one from Neil. Just so I'm clear, is the AI actually booking the appointment for the patient in the template, or is it just providing a summary of the call request and then a live agent or live person needs to go and then book the slot?
With the beauty of the Alex API, what we're able to do is directly book that in MedTech. So it's taking the message, doing the synopsis, but also making the actual booking. So that slot is taken. The other beautiful thing here is that the fact that the patient can call at 6 p.m., at 8 p.m., at 10 p.m., and do the same thing, make an appointment, or even they can't make their 9 a.m. appointment, they can cancel and free up that slot. And the Alex API and that integration allows us to do that directly in the PMS.
All right, next question. Very good one. What if there are duplicate accounts in MedTech for a patient? How does it pick which one to book?
This is a great question. I think there's a couple of clinics who had some very tricky things. Again, this is AI is not perfect, but for some reason, I think we are less forgiving towards AI and technology than we are to people. I know a clinic at the moment who does have a sort of similar sort of situation, and they have to even manually, a human has to go and just check that they're actually booking it in the right person's record. We would based on the contacts feature, we know the one-to-one relationship, but there could be complexities there. If there are duplicate slots there, it might be something that does need human intervention, and it needs a little bit of teamwork between Heron and a human to solve.
Okay, and from Priyanka, can we see if Heron has booked the appointment on MedTech to cross-check with the patient? What kind of appointment will that be, as Heron can't triage at the moment?
Yeah, I think so. Again, like Heron at the moment is designed to just work as an extension for your front desk. So there can be certain things that Heron can do and may still require a human to kind of fill in the gaps. Having said that, when we start incorporating different appointment types and things like duration or specific, even if it's telehealth appointments, for example, we will start seeing the type of appointment as well. So we're not quite there yet, but we are building towards it. But we need your input to be able to help us build the right thing.
For next one, can the patient book an appointment through their patient portal, and can it show Heron there on the template?
So no. So the one of the key things is that we're very specific, but because of how we handle security and how we handle what information we need, we only keep and manage the most minimal amount of information about the patient that we can. So we don't pull anything out of the PMS that we don't need to. So any sort of personal health information or anything else we're not going to touch. So we don't know their existing appointments. We can't read anything there. We're not going to pull anything out of MedTech. All we do is can check, poll, and see. Oh, that slot's not available. Let's try another one. Or oh, that slot's available. Let's try and book it. Or you have this appointment and we can remove that. Or you want to reschedule, we can do that. So it doesn't know anything else that can come into Heron. Again, Priyanka, like I think the source of truth at the end of the day is going to be your PMS. So you have an interface with Heron that you're providing your patients that they can use their voice to be able to make a booking into MedTech, and it appears in MedTech. So hopefully that is helpful for you. But again, yeah, it's an interesting question you ask. We're not trying to replace the PMS here. We're trying to work alongside it and kind of plug in.
Next question. I really like this question. As some of you might hear the croakiness in my voice, one of my small children recently gave me a bug. So on the back of that, could I book for a family member, like one of my children?
Yes, indeed. So in our contact section, one of the things that we do have is the ability to have relationships. So you can have your spouse or your kids or parents or other in there as well. So I can call and it'll ask me, and I think if you'd seen there, it identified who the caller was, but also the patient, and so those two are separate entities. And so I can call on behalf of my 3-year-old and say I want to book an appointment for my son or my daughter or something like that, and that can actually make that happen.
All right. Can it let the patient know about the wait time in the walk-in clinic?
Yeah, great question there. That's not something we have solved, Priyanka. Priyanka, you've got some great questions there. Um, yeah, I think there could be a way to do this in the future again, if that information is available somewhere. So yes, there's nothing we can't solve for a clinic, and the way we've architected this from the ground up is to fit in, not make you fit out how Heron works, is to actually adapt Heron to how you work. So if there are certain workflows that you need, we can kind of work with you to make that happen.
And last one in our current list. This is an excellent question regarding calls stored. How long are they stored for, and who covers recording storage?
Yeah, so we cover the recording storage, so that's stored in the Google Cloud side of things. It's all our data is encrypted at rest and while it's moving around as well. And the other thing is that we are going through penetration testing at the moment. That'll be a regular thing that we do at a regular interval. We're also going through SOC 2 compliance testing as well. So both those are in stream. And so from a security perspective, we kind of manage that very, very, very well. And from a storage perspective and how long we store it, by default, we store that for 90 days, but it's fully configurable. So if you want to store it for 30 days or 20 days or 15 days or 180 days, it's up to you, and we can do that.
Fantastic. That takes us right to that 2 o'clock mark. So I just in case anybody on the line is like me and comes up with any of their questions after they've had a chance to digest the material, and it's 3 a.m. and that's when all the questions come up. I'm sure the Heron team would welcome any questions, and you can absolutely contact us as well to get any of those questions answered. So if you do have any of those questions, please feel free to contact us. We're always here to help however we can. And I also want to very much recognize and thank everybody who's taken the time to attend the webinar today. Time is extraordinarily valuable, especially in primary care. It's in very hot supply. So we really do appreciate you taking the time to attend, ask questions, provide feedback. This is inherent to how we provide feedback to our partners, as well as making things work for you and not the other way around. So really, we do appreciate you taking the time to join us today. That said, thank you so much for joining. Enjoy the rest of your week. It's almost Friday, and we hope you have a wonderful weekend. Thank you so much.
So thank you, everyone. Appreciate it.